So I've come to talk to you today about a project that I've actually already done on my ward, and I'm still doing it at the moment. It's on mouth care because of a scenario I found when I've been in placement. Basically, I was on a chemotherapy unit, and an inpatient came down to receive his chemotherapy. He was at the end of life, and one day he came to the unit with a very dry mouth, a bleeding lip. As soon as I saw this, I was really shocked at his care, shocked that he was actually on a ward and this was still happening, where basic care should have been being done. When I asked him about it, he said that he had mouth swabs, but they were left on his table. The nurses didn't do anything with them because they were too busy. I also found out that he hadn't had his teeth brushed since his admission, which was 2 weeks prior to the conversation I had with him. So the IHI practicum has offered me the encouragement and the tools to go ahead and actually make a change. So, looking at some research then, I started looking into mouth care and oral hygiene and discovered that there's actually a huge evidence base demonstrating its importance in healthcare today. In 2004, it was pointed out that educational needs are really important in relation to oral hygiene. There's training needed for healthcare professionals, patients, families and carers, and there's a need to increase knowledge and therefore standards of care in relation to mouth care. The following year, it was found that there's a huge need for attention to oral hygiene in particular, and that increased awareness will increase standards of oral care in the elderly in particular. Last year, statistical correlations between poor oral hygiene and systemic diseases were found, between pneumonia and heart disease. And then in 2007, it was discussed that the prioritisation of advanced nursing practice actually leaves little room for basic mouth care, and the most basic of nursing activities, which is mouth care. It's also pointed out then that mouth swabs are ineffective, and it's also in the last week that they've been banned on all wards in Wales. But when I started this, they weren't banned yet, so I have been using them. There's also a number of government initiatives which include mouth care, such as the Department of Health Fundamentals of Care